Hello and welcome to Men's Monday with Dr. Karishma. Hi everyone out there. I'm just going to do a regular connection checkup as usual. Uh, can you guys hear me? Guys, give me a sign if you can hear me and see me. All right, people are waving at me, but I need a sign that I'm audible and visible. Sahaj, good to see you here. Hey Mansi, good to see you here as well. All right, Abhilash, wonderful. Prab, as usual, is prompt and has said that they can hear me, and I'm going to go live with Dr. Karishma because it is men's, and we are going to discuss today a very important topic on gender dysphoria. I'm not an expert, but I hear a lot of people. Uh, and here it is.
Hi.
Dr. Karishma
Good
is live with
evening.
us. A men's Monday after a little break that we took
Yeah.
in between. People were asking me, but yeah, there were creatives going out. We didn't come live, but we were in touch with all of you who were asking us questions. So, Dr. Karishma, Pride Month, a big
Right,
topic,
right.
and first of all, from from all the followers, all the people who are on my
Right.
handle, thank you from them on taking out time and coming out and discussing all
Yes.
this. And yes, important topic today.
Yes,
Over to
yes.
you.
So it's a very must to be spoken about topic. I'm excited to be. Hi everyone. And yes, 1 or 2 weekends, 1 2 Mondays, I was busy. So now it was after me, but I couldn't get through to do the live or do a men's Monday session because I was busy. And the last weekend I was kind of sick and not feeling too well. So that is why we got a little delayed. But I said it is Pride Month and we must do something. So yes, it's about gender dysphoria. And a lot of people have a lot of confusion about what is gender dysphoria. So, when we talk about transgender and then there is gender dysphoria, there can be a lot of, different understanding on these terms. So when you talk about the term transgender, it is someone referring to a person whose sex was assigned at birth. It could be a male or female at birth, but does not match their gender identity. So one psychological sense of their gender is altered. So you would be born probably a male or a female. But sometimes I could be born a female, but psychologically I've always felt different since I was a child. And they come into the category of transgender dysphoria. And some people who are a transgender, they are the ones who experience a gender dysphoria, which is the psychological distress that results from an incongruence between one's sex assigned at birth and one's gender identity. So, this whole gender dysphoria begins sometimes and most often during childhood, at puberty, but they are confused and we don't know about it until they grow much older. And obviously we never spoke about this in so many decades. It is in the recent maybe 5 or 10 years that we are talking more about transgender or gender dysphoria and the problems being faced from children right from a very young age. At one time, these little kids were discarded by their parents. The parents could not accept it. It is still sometimes such a social stigma. Nowadays I get patients from even smallest of towns, not just urban cities, who are coming out in the open more and more and are able to now convince their family, and families are beginning to accept who they are, because initially they thought the person is crazy. You can put them on psychiatric treatment and change the way they think. But if they believe psychologically, right, since they're a kid, then it is a genuine case of gender dysphoria. And that is when they want to believe that psychologically, I am not in the person, the body that I've born in. And that is why the whole concept of
Right.
transgender arises.
Yeah, Doctor. I mean, see, it is once we are accepting about, we talk about um, choose the career that you want to be
Hmm.
who you want to be, do things that you like. Everything we are getting
Right.
open to. But when it comes to this, suddenly there are the reservations, and I wonder why. obviously, people are not talking around, people who actually feel in this way. It's not acceptable, or maybe they were not aware.
Right.
So I think sessions like this, and the experts like you who
Yeah.
actually interact with people who go
Hmm.
through these
Hmm.
pressures secretly, or probably with the support of their
Right.
family. I think it's a great session. It's a great thing to be
Right.
talking about. And I believe we have someone joining us shortly who would also give us the perspective from her own
Right.
point of view
Right.
on how
Right.
she actually
Hmm.
feels about all
Yeah.
this as well. And especially, doctor, when we've identified this, that yes, there is something that we haven't been recognizing
Yes.
in past, and this is genuinely a condition. I would not say a medical condition or whatever, but this definitely is a
Yes, it is a
psychological state.
psychological state. It is not a
Why not?
medical condition, because at one point, they would take you for, go to a doctor, get treated. It is not something that you can get treated, and, it is what you feel. It is what I feel in my skin. It is what I believe mentally and physically. I am not happy in what I am. So it's not something you can treat, but yes, we have to psychologically evaluate the person's state of mind and understand what is their, what was their previous psychological state, and now what kind of a psychological mindset they are in. So, internationally, you have WHO, bodies like WHO, etc., who have categorized the whole concept of gender dysphoria. And there are various different categories I don't want to get into, because it'll be, very medically challenging for people to understand. But terms like binary, some people like, what do you mean by a transvestite? What do you mean by transgender? Somebody could just be a cross-dresser, likes to dress up in the opposite gender clothing. So there are various categories, and something like this is better evaluated by a professional psychiatrist and a counselor rather than me. So when I have my, persons coming to me and approaching me that, I believe I have gender dysphoria, or I'm confused, or when they come up with some issue saying that, the first person that we tell them to approach is a professional counselor, who can counsel them, understand their state of mind, and get to know in what category of gender dysphoria they are in, So it's usually an incongruence between, one's experienced or expressed gender and the primary gender that they are, and the strong desire to get rid of one's primary or secondary sex characteristics, because of, there's a difference physically and mentally in them. So the strong desire to be another gender, strong desire to be treated as another gender, and a strong desire and typical feelings that I'm not getting as, being the person I am, and I'm getting the feelings of the opposite gender. So these are the usual symptoms when a person, you come across and they are showing symptoms of these kind of psychological desires or feelings. Then we must guide them to a counselor, and that is the first step that we take, so that they understand what they are going through, and there is somebody who can counsel that it's okay that if you have this issue, but there's no issue. It's just that now you need to accept what you are. And, there are months and months, or sometimes
Yeah.
years of counseling, which goes into a lot of the people, because, first of all, they are so stigmatized, socially stigmatized, that they also go through phases of depression. I've seen so many of my patients, coming to gender assignment surgery, that's much later, and it's probably the last, sort of path. The first is counseling, and
Right.
because they are
Right.
very depressive, many of my patients, and once they start the counseling, then they start getting that confidence, they start accepting what they are. So it's not that something is wrong with you
Right.
psychologically. That is why you have to meet a psychiatrist, but it is, they help you understand yourself, they help you understand your state of mind, and then when they start to accept it, they feel better, they do better, and they get more progressive, mentally.
So this is a very interesting one, doctor, that you actually mentioned, and I know of a lot of friends, and I've been looking at statistics as well, that the cases do get suicidal at a lot of extent. And I had a very close associate who actually committed suicide because of this reason, and I'm going to have a different session on that completely. But interestingly, doctor, that you have mentioned that once somebody comes to you, with a feeling or a desire of probably a physical change that they want, the first thing that you put them through is a counseling, is an expert who actually understands what they're going through mentally, and then is the second step or second stage is with you, which is kind of an interesting thing. It's just not that I felt suddenly that I'm this, and suddenly they kind of do a
Yeah,
physical
yeah.
change
So
that
it's
they come and
also
do. So
it's
very
also by
interesting.
law, by law, we have to make sure, we have to be sure that the person understands the process that they're going to go through, and their, first of all, their mental mindset. And this mental stability is very important before you even think of a gender reassignment surgery. And not many people want to do it. Some of them are
Right.
just happy accepting the fact that this is who I am, and just counseling and psychiatry is enough. But it's for those who want to go the extra step and, say, no, I want a complete transformation physically, emotionally, in every which way. And then we have to, with side by side the counseling therapy, we need to approach an endocrinologist, someone who will give the hormone treatment. So the ways to go about it is counseling, psychiatric evaluation, and then go for hormonal replacement treatment, where if it is female to male, we have to put them on testosterone injections. So what happens, and we have to suppress the estrogen progesterone. In case of male to female, we have to provide progesterone and estrogen hormones, stimulate that, thereby reducing the testosterone. So what happens is, with the hormone replacement, your secondary sex characteristics begin to change. So in a female to male, when you start testosterone,
All right.
they start noticing body hair, facial hair, the voice modulates, there's a change in the voice, and the vocal cords get stronger, they start building more muscle, and they tend to look physically more manly, and vice versa for the other way around. So when all of this is going, in tangent with each other, the psychological evaluation, hormone replacement, after about 8 to 10 months, or we say at least minimum 8 to 10 months, then we usually prep them for the gender reassignment procedures. And that is with official letter of go ahead from their psychiatrist. So the psychiatrists have been with them, they've understood, and now they know that the person is mentally and physically ready for that change, because it cannot be a hasty decision. It's life transforming. It just completely changes your whole life. So with the letter to go ahead, yes, you can go ahead. This person is absolutely ready for the transformation. And only then we go in for the different kinds of procedures.
So wonderful. I mean, I very honestly, sitting outside, I really didn't know that it's such a comprehensive, procedure that somebody goes through. What about smaller procedures, doctor? For
So,
example, I've had a lot
yeah,
of men talking to me
yeah, yeah,
privately, saying that they would want the facial changes or
yeah,
lip changes, or probably
yeah,
breast
yeah,
job done, or
yeah.
reduction or whatever.
So,
How
you know
does
what?
that,
It's,
does
as
that
I said,
follow the standard
there are,
procedure?
not everyone wants to go. See, the regular gender reassignment, the major surgeries are just two. One is a top surgery or a bottom surgery for both, genders. So the top surgeries are usually the simpler surgeries where, there's a breast removal, creating a flat chest. And for male to female, usually we do breast implants, because men, the chest skin is very tight and doesn't have that much volume. In some cases who are a little plumper, we have a little volume. So to add, the only way is doing fat injections or giving a breast like appearance by doing implants. These are more simpler procedures. When we come to bottom procedures, it is when it gets complicated, very complex, long procedures, require multi-speciality approach, not just a plastic surgeon, but a urologist, needs sometimes a gynecologist, and not everybody sometimes go through with it all the time, because some of them don't want to take such big risks. But yes, we do it for a lot of patients. And then there are a few persons who, transform themselves just physically by dressing in the opposite gender and doing just facial non-surgical procedures, as you said, like fillers and Botox. And you can, sort of change the jawline, when it is male to female. I got this question. I put a question up on Instagram just 2 days back, and many people asked me about what can we do for feminization. We call it masculinization or feminization procedures. So the feminization is, like we want to create a different jawline. So if the men usually have a very prominent, these masseter muscles, and makes you get that jawline that you have, the square jawline. So we give like simple Botox, reduce this bulkiness of the muscles. So give, do a little fillers on the chin. We can create a sharper jawline, make it more feminine. You can do lip fillers. So there are a lot of simple things that one can do. In men, you tend to have a more wider forehead than women. So many of the feminization procedures even involve doing a hairline advancement. You can just do hair transplant, and we get them, to make it like bangs, in a later date, in months to come after a hair transplant. So these are all simple procedures where, they're called just masculinization or feminization procedures, non-surgical, simple outpatient, you walk in, walk out and do these things. Yeah.
So these are cosmetic
just cosmetic changes.
The physical.
Yeah, and like a lot of men do laser hair reduction. So a lot of them do laser hair reduction because they don't want body hair anymore. So, or they don't want the beard. So we do multiple sessions of laser hair. So
who does not want beard? I want to know.
So, we want to change that gabru look, the no beard. So, we have to, so we do like, hair removal for the body. But the other way around, when we start giving testosterone to the women and they start getting facial and body hair, like today, you won't believe it. It's such a coincidence that this morning, one of my patients, who is in a small town in Tamil Nadu, and I had 2 years back done, we had done, counseling. She had done a complete, hormone treatment for 8-10 months. And then, when she came to me, she was, and with her permission, I am using her name because she messaged me in the morning. But I have to address him as he now. So he called me in the morning asking how I am doing. And I had done his top surgery, the breast removal. And he has done a beard hair transplant, like a beard transplant, creating a beard, literally, and he was known as, she was known as Shashikala before, but now he is Shashi, and he's married with a woman now, and they have had, they just got a baby boy through IVF for his partner. And they gave me the good news today that we got a baby boy 2 days back. And yeah, I mean, they are a happily married couple. He is comfortable in what he is now, and the family accepts. And she was initially the daughter. Now he's like the son of the family. So the father accepts him as the son of the family. He takes care of the business. And they are happy. They're content. And it's just the life changes completely.
But have you seen this? I mean, this brings me to one difficult discussion, and it's for provocation, may not have answers. That it's easier for probably women, maybe the way the society is, women to actually want to be a man than a man wanting to become a woman. Is there a larger stigma around it? Is there a larger shame around it? Have you faced something like this?
Yes, they have. Because, over the years, you still have seen a lot of, male to female transformations, and it was still okay for a man. Females to come out was very difficult. And, I am seeing young girls, and now the percentage of people coming out in the open at a younger age, and we're talking about 19s and early 20s, is much higher. But, it's difficult both ways, because of their, the problem of victimization, discrimination, and high levels of stigmatization. So these three things contribute to such a negativity in their mind, and a negative self-image. And actually, it increases the rates of mental, because of their negative self-image, because of their constantly being
Right.
victimized, and because of the stigma, and
Right.
they are being discriminated, and all of that created more mental health disorders for them. And then that's when, you talk about the suicidal tendencies, depressive moods, etc. But to be very honest, since the law was passed in India, the few years back, by the government, people are out now in the open, so much more acceptable. Even the older generation is accepting it much better, because even they did not know. Still, this law came out, now they are also getting more aware. And, the general people
Right.
who are watching us today, I mean, so many of them may be shocked at the number of things that I'm actually saying. But, all of this kind of, yeah, it's a very
Right.
comprehensive way to approach it. But if done in the right way, in the right direction, and you put a person, so when someone approaches you or confides into you with any of these symptoms or signs, it could be somebody in the family, or, I don't think we should disregard, disrespect, and push them away, but try to understand better.
Doctor, at this point of time, with the family members' permission, last autumn winter, the content that's on my page right now, I had a stylist called Supreet, and he was going through a similar situation. He had support of his family, luckily, and but unfortunately, people around were non-accepting, and he had to, sadly commit suicide. And he's no longer with us. And such a gem of a person, so talented, for his age. And we lost him just because people around did not understand, or people did not want to understand. So that brings me to a topic, just a discussion point as well, saying that, hey, if it does this law or also needs permission from somebody before they approach an expert, or somebody like you saying that, hey, I want to, be somebody
Yes.
else. I'm psychological somebody else. Does it also require permissions from, various people around, or they can directly approach you and then psychologically get evaluated and
No,
come
so
on? So
there's
I
no
think,
government sanction or permission that you need. If one experiences any of these feeling of dysphoria or gender expression issues, as I would put it, yes, they can meet their. It could be their family doctor, it could be a plastic surgeon, it could be directly with a psychiatrist or a counselor. It need not just be a plastic surgeon directly, but they have to meet them, and you don't need any permission for it. You can directly meet a psychiatrist, counselor. And it's just that there are a lot of people who finally want to change their name. So like my patient that I spoke to you, and this is a real example, is that she changed his name from Shashikala to Shashidhar. And yes, there is the now the availability that you can put your affidavit in the court of law, and you can change your name. And a lot of the working spaces today, when they join, it was first only female and male, but now they do add the transgender tab. So you can put yourself as transgender. But for people who have actually completely, change the gender and reassign themselves, they can tick box on the gender they want. So if I have changed my gender from female to male, I can put tick mark male, and buy an affidavit in the government. Once I've finished my transformation, I can apply it, put an affidavit. It goes through very simple procedures. It's not a very hectic procedure. And then you can create your fresh documentation. In terms of, the only hectic part is then you have to reapply, change your passport and change your licenses. But you can categorize yourself as male if that's what they are and that's what they have assigned. And, the proof of the doctor, everything has to be possibly put during the affidavit and things. But it's rather become possible now.
right. So, the experts are on the side, the law is on your
Yes.
side. It's just that, probably the way people think would change. And I think efforts
Mm,
like
mm,
these,
mm,
doctor, would bring in slow and
mm.
steady change. And that's about it. I'll open, in case there were viewers, in case there are some questions that they want to throw at you, especially because I'm not the expert. I just I'm mediating.
Right.
In If there are questions, they can throw to us right now. or maybe DM to us, later in case they are, they're pretty shy about
Yeah.
asking it. Anything else that we could add?
And I think what we're going to do is today we did
That's
want to get a surprise guest, but my guest disappeared and she's not answering my call. She's
I was
not
not
answering my
mentioning.
call and I think she forgot and she's probably tied up in something. But what I'm going to do is we're going to do another session next Monday for sure. We're going to discuss further on this topic and we're going to try to get our guests and maybe a few more guests for even short span of time to understand their views and what they have faced or what are the kind of trials that they have gone through to accept themselves and be out there in the open and be proud about it. So we are going to do another session again, but I think today was more of an expert, kind of giveaway. I wanted to highlight about what is gender dysphoria, and I hope everyone kind of got a gist of it, and I hope I didn't speak too many medical terms, but the takeaway is stop victimizing, stop discriminating, and stop stigmatizing, stop creating a stigma around this. It is not an issue. It is what it is. Person does not have any mental or a health issue. They're psychologically, nowadays they're researching even various kind of genes. There are genes and they're named that a person having this gene can probably have the gender dysphoria. So it's a far more intense kind of path. And I think, in fact, Naved, very soon I would probably want to get, in our next session, I'm thinking I would get, a psychiatrist that I know, a counselor, to actually join us in between live and, give us even more details about what they see on a daily basis and how they experience. So we're going to probably get a psychiatrist, on board with us for a live session next Monday. So you will get a further expert opinion and
Right.
others can understand. So even more than what I just gave an overview, but there is so much more details into the various
Right.
different kinds of gender dysphoria. So I think this is a very good thing. And I feel next week we'll have a psychiatrist on board. So all of you, please, tune in next Monday. Also, we're going to continue our Pride Month discussion on the LGBTQ community. And we are here to support you. And we must all support them. And it's extremely important because they need the mental support. And that's what helps them to come out there and be happy in what they are.
Yeah, and Supreet's brother has also agreed to be with us
Okay.
next Monday. He would want to say how family member feels when there's such a loss, which is not, we don't need those kind of losses. So he would want to also come and express his feeling on
That would be
how it is
wonderful.
important that it is
That would be
identified.
wonderful.
Yeah, so he's agreed to be there
Perfect.
next Monday, and we would discuss this
Perfect.
further.
Thank you, Naved, and thank you all for tuning in and do support our cause. If you can share this live video. Of course, I always have giveaways and surprises. So I would like you to download this live session, share it on your story, or if you can even put it on your feed post. It will help to support a lot of people out there. It's all about educating, just spreading the awareness. And if you can do all of that, the coming Monday, we will see the maximum, the person who has shared, liked, or commented on our live video. And those who like, share, and comment, and all three will definitely win a prize, and we'll announce it next Monday during our session. Sounds good? All right.
All right, everyone. Yeah, Men's Monday.
Men's
Signing off.
Monday.
Dr.
See you
Karishma.
soon. See you next Monday.